Hi, good afternoon. This is your County Executive Ed Day, and we're here for our bi-weekly update on the COVID-19 crisis here in Rockland County. First of all, before I forget, make sure you have a pen and paper handy in case you want to take some notes that might come in handy today. I'm going to start off by giving you the typical update, which is sadly the latest death and hospitalization info here in Rockland County. I have some really good news. We did not report any new COVID-19 positive deaths here in Rockland County. Not one person met with a demise. It's the first time since March 21st, it's nearly 2 months, that we have not had that loss here in Rockland County. So I'm very, very happy to see something positive happen here for a change as it relates to this virus. Hospitalization numbers, they're continuing to decrease also. The data is separated by numbers into two categories: those who are hospitalized with COVID-19 and those who are suspected of having COVID-19. 4 weeks ago, on April 21st, the total for both categories was 287. 3 weeks ago, the total was 232, 55 less. 2 weeks ago, on May 5th, the total was 185, 47 less. And today, today, it was 116, 116. So it's a precipitous drop, downward trajectory, whatever you want to call it. But finally, we're seeing some positives in a dark time in our county's history. First, I want to address everyone's top question: are we close to reopening? And everybody's been looking at the dashboards, trying to figure it out. Let me just lay some basics out for you. The Mid-Hudson region, which Rockland County is part of, has met 5 of the 7 criteria for reopening. I think today in one of the local outlets it reported is 4. It is now 5 of the 7 criteria. Hospitalizations were down, so we did pick that one up. The 2 criteria we have not yet met is a 14-day decline in hospital deaths based upon a 3-day average, and having at least 30 contact traces per 100,000 residents, which would be about 100 traces for us here in Rockland. Let's understand something. There was supposed to be a plan, as you all, I'm sure, read about. Former Mayor Blueberg was putting together a plan to hire contact tracers. Contact tracers' job is to, once you identify someone who has this virus, to find out where that person was and interrupt the virus by getting a hold of people that he or she may have come in contact with, and then have them self-isolate so they don't spread the disease further. This sounds familiar. Yes, it does. We did this last year for the measles epidemic, and they're doing it here again. Excuse me. But what happened was that there was sudden change. Sunday, late afternoon, I had a conference call with the governor's office again. We do 7 days a week here. And we were informed that apparently, because nobody really wanted to own up to it, apparently the plans for the new contact tracer effort from the state was not quite where it should be. So they were asking the counties to pick up the slack. And we are doing that. We're not going to fail as a region because everybody is not picking the ball up and running with it. I don't care what state agency does not move quick enough. We're going to move. We're going to be nimble and quick here in Rockland County. So we went from about 30 traces, which was fine at one point. We are now at 100. They're finalizing their training right now. And we have phase 2 of picking up personnel. We 40 more people, and then 25 more is our goal. So we're looking to get to 165 within the next week. We're working to identify any additional traces. We've actually had communications with our towns, our villages this morning. Asked them for some help if they could help us out here. Again, we may not even need these traces. In fact, because if there is no spikes and no reinfections that warrant that type of action, they will not be needed. So right now we're bringing volunteers on, and the state will be picking up people by hiring them. But because we are continuing to see deaths in hospitals around our region, we cannot say for certain when that final metric will be met. We are participating in the daily regional calls to discuss criteria and the specific steps being taken to meet them. And we will share any decisions that are made regionally as quickly as possible so we can ensure that the public and local businesses are all on the same page. I want to ask John Lyon, my communications director, who you do know as the man behind the curtain. And if those of you who don't know that phrase, go Google it. 1939. It's a very famous movie. I'm not going to give you the answer. You have to look it up if you don't know. But John has been taking some questions, and he's going to throw them out now.
Bonus points to anyone who writes the name of the movie in the chat right now.
There you go.
Those
competition.
Those bonus points are not actually worth anything, but we'll give them to you anyway. So thank you to everyone who submitted your questions today. First up, do you have an idea of what businesses are in what phase?
I certainly hope so. They kind of expect that of me, John.
Yes.
But yeah, the phase, general description, we'll get into the specifics later on. You'll be doing that in your own, actually. Phase 1 businesses include construction, manufacturing, retail with curbside pickup, wholesale trade, agriculture, forestry, fishing, and hunting. The latest information, including guidance for how these businesses should operate, is available at forward.ny.gov. Again, forward.ny.gov. That's the website. And you should look at it because at some point you'll be coming out of your homes, you'll be going into businesses yourself, and you want to know if they're doing the right thing. So take a look on that site. There's a lot of good information, which we're going to get into a bit as we go along. Phase 2 businesses include professional services, retail, administrative support, real estate, rental, and leasing. Phase 3 businesses include restaurants and food services. Phase 4 businesses include arts, entertainment, recreation, and education. And again, New York State has not released what specific types of businesses falls under each of these categories. It is expected we'll hear more from in each additional phase as the information is shared. But the latest information that's available is at that website, forward.ny.gov. You'll get some sense of exactly how this process is playing out, how it's going to work, and it'll be helpful for those like you who are tuning in today. You obviously thirst for knowledge, you want information, and we're happy to share with you. But a reminder to all, each business and industry must plan to protect employees and consumers and make the physical workplaces safer and implement processes that lower risk of infection in that business. That plan must be on file at each business because that will be inspected. In developing these plans, businesses will need to consider 3 main factors. And to be clear, these requirements are the responsibility of businesses to meet. They will have an ability to go to a template that is on that website. They also can go to their industry groups, their trades organizations, who have been engaged actively with this office and our business development office. They're trying to come up with sound approaches and protocols that will make things safer. The first factor in the protections is for employees and customers. That is number 1. These include possible adjustments to workplace hours and shift design as necessary to reduce density in the workplace, enacting social distancing protocols, and restricting non-essential travel for employees. The second are changes to the physical space and the physical workspace. This includes requiring all customers and employees who wear masks if it's frequent close contact with others, and implementing strict cleaning and sanitation standards. The last factor for businesses to consider is implementing processes that meet our changing public health guidelines. As we know, this has been evolving. Obligations such as screening the individuals when they first enter the workplace or reporting confirmed positive to customers. Also, as I said, forward.ny.gov that provides a summary of guidelines for each industry along with a business safety plan template. So at the end of the day, these industries and these outlets do have their own counsels who are advising them and giving them very good ideas, but there's a template on the website. In short, there is no excuse why they cannot comport with reasonable guidelines that are designed to open our economy in a way that makes you safe. That's the best way we can describe this. And there will be inspections. We spoke this morning to all the mayors and the 5 town supervisors. There will be an all-hands effort. We are looking to basically educate and gain compliance. Nobody's going to go out to try to hurt our businesses. They've had a tough go as it is. They're going to do their best they can, and as long as they do and they comply with the protocols, we're all going to be happy. But at the end of the day, if they do not, we will deal with it in a more punitive manner. I don't think we'll see that based upon the response that we've gotten so far. So again, We're hopeful that it works out well, but hope comes with the other piece of it, which is we do verify.
Okay. We've had some nice weather recently. Getting a few questions about what's going on at Rockland Lake and what New York State is doing to increase monitoring there as the weather warms up.
Right. Okay, good. Look, first of all, Rockland Lake, I think people shudder at what they remember from 2 years ago on July 4th. It was absolute mayhem there. And what we did after that is we pulled together the representatives of the Palisade Interstate Park Commission, members of law enforcement, emergency responders, state representatives, and representatives from town governments to create a comprehensive plan on how do we address the crowds that tend to hit our state parks, and particularly Rockland Lake and the surrounding communities, the impact upon them, Valley Cottage and Congress. We did implement that under the auspices of a fire and emergency services personnel. The plan was professional. It was done the right way. And again, with my background in law enforcement, I certainly understood that. But everybody pulled together, and we did get that done. Labor Day came and went. Nothing major. We went through the following year. Memorial Day, July 4th. We made sure that there was not mayhem that was there 2 years ago. We included tow trucks in that too. That seemed to have a good effect on some people who decided that we're going to ignore the no parking regulations. But anyway, just so you're aware, our Office of Fire and Emergency Services already has reached out to all the involved parties, essentially to ensure a replication with critique is done to make sure that the best possible effort can be made to be ready for whatever gets thrown at us. We're going to have some challenges here. Right now, New York City has announced they closed their beaches and their pools. That's not good, because what's going to happen, people are going to look to go elsewhere, and they may end up coming up here in higher numbers. All the more reason why these plans have to be pinpointed and done properly. The plan itself calls for increased park staff within Rockland Lake, additional preparation and monitoring of the situation outside the park, and absolutely no tolerance for bad behavior or illegal parking. So we will have the same complement of personnel, the same marching orders will be there come Memorial Day and July 4th in particular, and we'll do everything we can do, whatever measures we need to do to improve communication and coordination between all the involved agencies, because that's how the plan was a success, coordination.
Okay, we received a number of questions today about essential personnel that deserve hazard pay.
Right.
Some local organizations have begun paying their employees more, while some others have not. What can we do about this, and what is the county specifically doing about it?
Okay, well, obviously, as a former member of law enforcement, hazardous pay was always something I would love to have gotten. We didn't get that, by the way, but it's not something that's just started by county government. We do not have any control over the practices of privately owned businesses. It's up to each of them to determine if providing hazard pay is the right course of action. Obviously, what my heart is, it should be pretty obvious. But there was recently introduced federal legislation called the HEROES Act, which would establish a $200 billion fund and ensure that essential workers nationwide who have risked their lives working during this pandemic receive hazard pay. The HEROES Act has passed the House of Representatives. It has not been taken up yet by the Senate, so it is unknown right now at this point when it will move forward.
Okay. Has there been any decision about pools, summer camps, or other summer programs? This
is, and you may know if you've tuned into this more before, we have daily phone calls with the governor's staff. We're part of what's called the control room for the Mid-Hudson region now, so there's a lot of people there. We have brought this up numerous times. I think what has come up here is that there's no decision yet. I think the concern that they're probably having, if I can guess a bit, is the fact that they've had a few cases with children who have a SARS type of upper respiratory disease. They're concerned there may be a connection to the COVID virus. So that may be part of the issue right now, but it's up to the governor's staff to make a decision. Any pool has to be approved, use has to be approved, but well, let me just change that. I don't want people to get worried about their own backyard pools. Any non-private pool, I mean your backyard pool, that doesn't apply. All the other pools have to get permits from the State Department of Health. So with that, it's going to be their call to make as to whether or not pools will open. I'm hoping they do open them. I'm sure I got a feeling most people are kind of hoping the same thing.
Sure. Where can people go to receive testing for COVID-19 and the separate antibody test?
Okay.
What do we need to do?
Okay. For testing, you can call your healthcare provider, number one, or the New York State Department of Health coronavirus hotline at 1-888-364-3065. Again, 888-364-3065. They will tell you where and how you can get tested. Now, in terms of antibody testing, there are a number of private facilities offering antibody testing, but they are not affiliated with either county or state government. So you're best off reaching out to your own doctor and asking who they recommend. New York State has been conducting random survey antibody testing. No official site has been set up here in Rockland County. We have not been apprised of the results of this yet, nor the operations of it. So it's been done. There was some done in Rockland, as I believe, but we were not made aware of where it was. It was just taken and moved forward.
And sticking with antibody testing for a minute, can you confirm those of us who have had antibody testing done, are they counted as a positive for daily numbers of active cases? This person is concerned that if that is the case, we would never meet the criteria to reopen.
Thank you so much. Would you like to come to work with me? Make sure please find that person. No, to be clear, now new reported cases are not one of the metrics used by New York State to determine if we can reopen. So I can put your mind at ease for that, but it's a great question. I can confirm that antibody testing is not counted towards any of the new daily reported cases we receive from New York State.
What are the current rules about having small family gatherings outside at my home? If we social distance and remain outside, is this okay?
Well, here's the rub. The governor's orders are very strict, and they do not allow for gatherings of any size. That guidance has not changed. We did here in Rockland County try to make an accommodation, which was accepted by the Department of Health, where we put a number on it of 10. We felt that with 10, that would be something that would accommodate a large family. It gives a little bit of room. I don't think anybody is looking to hassle someone who has, mom, dad, and 4 kids on the front lawn. But that's a gathering. So I don't know the answer to that. It was never clarified. The 10-person rule has expired. And frankly, what ended up happening is we did in some cases give that extra guidance. And instead of 10, it became 20 and 30. You'll give an inch and you take a mile scenario. So that policy did expire. So now we're back to the original orders from the governor.
Okay. Several people wrote in, still concerned about nursing homes, that they may not have enough tests. Can you tell us a little bit about what's going on?
Yeah, I understand your concern. I've had to speak to a number of your neighbors on this, getting a lot of messages of the concerns of their families, and we've had a significant amount of people who have died in nursing homes, which, again, you've read up on that already. But on May 10th, 2020, Governor Cuomo signed an executive order number 202.30, which mandates twice-a-week COVID-19 testing of all personnel in nursing homes and adult care facilities. We got directly involved with this. We made sure that these COVID-19 test kits were in fact delivered to nursing homes within Rockland County. The test kits were provided to the county by the state of New York and were allocated based on the number of staff members at each facility. The Office of Fire and Emergency Services inventoried, sorted, and delivered the kits as directed by our Commissioner of Health. Now, while the County of Rockland does not have any direct oversight of these facilities, that is something that is a direct responsibility of the New York State Department of Health. We are doing everything in our power to help our residents. Obviously, there's a lot of things going on right now. There has been for some time. It doesn't mean that we will not make an effort to augment whatever potential shortcomings there may be. So I'm very, very proud of our health department for the work they're doing to serve as a backup for the State Department of Health. This is a very worrying and difficult for many, many people out there, especially since you're unable to visit your loved ones. And that's something also that's being looked at by the state. That was part of our conversation today on the phone call with the control room. Our Department of Health will continue to follow up with each of these facilities to ensure that each agency is aware of the proper protocols and help them as we are able to. In addition to the test kits, each facility may direct their personnel to local drive-through or walk-in testing sites. Personnel can call 1-888-364-3065, the same number as before, 888-364-3065, 364-3065 to inquire about testing or any related questions, and this is a 24/7 number.
And the last question of the day, any idea when the DMV will reopen?
I'm just ready to go running down there and wait in line for 7 hours. The DMV offices, as we know, are closed, and all road tests have been suspended until further notice. Licenses and registrations expiring on March 31st or later have been extended until further notice. While some things can be done online, and if you can do it, by all means, you should do it. Other things will unfortunately have to wait until DMV offices reopen. I believe registering a new car is problematic, so hopefully your tried and true vehicle that may be 7 or 8 years of age is still functioning properly. Not a time to buy a car because you're not going to be able to register it here. But what you can do is if you want more information on this particular issue or anything related to the DMV, please visit their website at dmv.ny.gov. Again, dmv.ny.gov. In closing, I have a few extra pieces of information I would like to give to people. The state DOH health line, which I did get, a hotline I did give out, the 364-3065 number, 888 is the area code. The New York State pause hotline, this is when you see things that are not supposed to be, especially if they're static. We're not talking about a group of people who are not socially distancing and walking along the street. We're talking about a facility that's open that should not be, or you believe should not be, or your checking has shown it should not be. You can call this number. They will vet the complaint, and if it's a founded complaint, they will get it back down to 3 points of contact here: the Sheriff's Department, the District Attorney, and also our Deputy Commissioner of Health. The pause hotline is 833-789-0470. 833-789-0470. That again is a 24/7 line. Also, we mentioned earlier before the Forward New York website, which is really very current now. It's forward.ny.gov, forward.ny.gov. Also, you have the New York State website of ny.gov. There is information on that site too, related to the executive orders from the governor. It'll give you some clarity if you feel like researching something. And again, it's ny.gov. And of course, your very own website here in Rockland County, rocklandgov.com, rocklandgov.com. There is a lot of information that is on that website, particularly when it comes to this particular issue of coronavirus. Do's and don'ts, things to look out for, most current information going on about isolation orders, things of that nature. There's a lot of information. You go right to the main page, you can't miss it, and you can go right to the health department and you can get to the answers that you seek. Just in closing, again, we try to bring this twice a week to you just to get you updated. We know this is important. There's a lot of trepidation out there, a lot of worries, and it's understandable. I mean, we've talked about this before, that right now some people are really in a panic. Mental health issues can abound at this point. So, it's important that you look out for your neighbors and your friends and your loved ones to make sure they're okay, because the fear is real, and we certainly understand this. This is a challenge like none other seen by many people in their lifetime. I just want to make something very clear. A lot of conversation that I catch up on social media, in particular, on my Facebook page, in particular, Ed Day, Ed, D-A-Y, is my Facebook page if you do Facebook. And what I see is most people have a very balanced idea or thought about exactly what we should be doing right now and how we should be doing it. I think most people understand the economy can't remain shut down forever. We have to take our baby steps and start getting out again. Some people want to do it quicker than others, but there's a vast majority of people are right in the middle, where they recognize that there's no such thing as 100% safety at all. There never will be in anything. But they recognize that there's a reasonable amount of safety, a level they can accept, a level that makes sense to them. And that really is what it comes down to, because any steps we take have inherent risk, but they're things that we necessarily have to do. There's risk when we get out of bed in the morning. It's just a fact of life. So I just ask people to understand that our efforts here are going to be guided by one very simple motto: safety first, people always. That's something you can count on. That is how Rockland County is going to move forward as part of the region, and that is how we govern here in Rockland County. So with that, we'll say good afternoon. We plan on seeing you Thursday at 4:15 also. And also, just so you're aware, to your friends who don't have Facebook, we will download this and put it on YouTube. I will be sending out a blast email probably tomorrow with that YouTube link. Electday.com, electday.com, or edday.us. You can sign up for that email blast directly, and you will get an automatic emails of other topics also, but you will get the version that's on YouTube if you don't have Facebook. So with that, have a wonderful afternoon and God bless.